Right.
Robert O'Dean, who do we have with us today?
We are so honored, and as you all know, on the Wake Up Morning Show, you are subject to get interviews from so many different types of people doing different things in society, making a difference. We don't just do music on this show.
Yes,
We
yes.
get people that are doing great things that can help us because lack of knowledge is not good for us. We're
Amen.
powerful when we know. So without further ado, this is the doctor of the foot and the feet and the ankles. None other than Dr. Bill Releford. Good morning and welcome to the Wake Up Morning Show, my brother.
Good morning, good morning, good morning. How's everybody doing?
We're good, and he has the Releford Foot and Ankle Institute. So when he got his own business and it's called the Institute, this man know his stuff.
Amen. Good morning to you, sir. I'm just gonna jump right in it and put my feet all the way up in it.
Yeah,
right now.
put your foot up in it.
That's what my grandmother used to say when she used to make the peach cobbler. And some pie, she said, I'm going to put my foot in it this time.
Right.
Yeah. So let me just ask you, because a lot of people are experiencing this right now, but they're experiencing this whole arch support pain and plantar fasciitis and all this other stuff.
Plantar.
Is it plantar?
Yeah.
And not plantar? Okay. Is it plantar or plashar?
Plantar fasciitis.
Okay, thank you very much, because he loved to correct me in front of the important people. So anyway, you know what I was talking about. I want to ask you a question. Do I got to spend almost $1,000 to get those insoles from Good Feet, or do you have some recommendations?
Right.
Well, I have some recommendations. The first thing is, if you're carrying a few extra pounds, losing a little weight is the best treatment.
Okay.
Wow.
I've had a patient who had painful ankles, painful arches, and feet and heels. She might have been close to 500 pounds.
Wow.
I told her, I said, you know what, if I was a foot or an ankle, I'd be hurting too. If I had all that on top of me.
Right.
So the real thing in our community is to come up with real viable solutions that have some longevity to it. So part of it is with a lot of people carrying the little COVID-15. The feet, we're getting that increase in people with foot problems, knee problems, and back problems. So that, to answer your question, that's what that means.
So it's like the foundation can't take all of that,
Can't handle it. And the body has a strange way of talking to you. Many times we just don't want to listen. We want to do it our way. Sometimes the body will speak very, very eloquently to you about what's going on. You just got to listen though.
Right.
Okay, so let me start off from the giddy up. How did you, in all the practices, how did you start focusing on the feet and the ankles? What made you so interested? Do you have a foot fetish?
You know what? Since this is a gospel show, I'll tell my story.
Okay.
How sometimes destiny and assignment will carve your path.
Yes, sir.
When I was born in a little town in Oklahoma called Wagner, outside of Tulsa, between Tulsa and Muskogee. And when I was a little boy, the little old ladies in the community would tell my grandmother, would you send that little boy over here to rub my feet? I was probably 4 or 5 years old. And I guess I must have been pretty good at it, because they would give me Pop-Tarts. That was a big thing, give the little boy Pop-Tarts.
Right.
And Miss Sally was her name. That was I guess you said that I was official first patient at 4 or 5 years old. My folks moved to Los Angeles, and there was a little lady across the street. And I've always been a hard worker, and I would take her trash out every Thursday for Friday. And she says, you know what? She was on a walker. She was about 90 years old. Can you look at this thing on my toe? Whatever I did at 10 years old, I fixed it. Her daughter comes to town to take her to the foot doctor. She says, you know what? I don't need to go to the doctor because my doctor's across the street, the little boy. And that. So, and then I did a lot of work in West Africa with tropical diseases on the college that affect the lower extremity. And then after graduating from Podiatric Medical School at Temple in Philadelphia, coming back to LA, I realized that our people have the highest amputation rate in the country.
Yes, sir.
And I was trained in limb salvage or limb preservation, meaning preventing amputations. And in our community, I was seeing three things: diabetic, African American, and recommended for amputation.
Wow.
And at that moment, I realized that this was something that I needed to dedicate my life to addressing the astronomical pain and suffering that we experience. Of course, we already know what's happening on TV right now with the trial with George Floyd.
Yes.
But this pain has been ongoing, even beyond that, and just ongoing pain and suffering in our community. So I decided to develop various programs to decrease the amputation rate in our community. You may see that I founded the Black Barbershop Health Outreach Program.
Yep.
But you may have a question about that, but I'll let you.
So let me ask you this question. Thinking about amputation, diabetes, hypertension, and things of that nature, how do you, you might walk all day and your feet are hurting. How do you rejuvenate your feet or reestablish good circulation in your lower extremities?
So that's really not, I would say, establish good circulation in one part of the body. The feet are connected to the whole body. So you got to treat, once you take care of the whole body, all the pieces come into play. So to answer your question, diet and exercise. Diet and exercise. Remember, Jesus walked everywhere.
Yeah.
He must have been in pretty good shape.
Pretty good shape, yeah. Yeah, that's true.
With all that walking. So I tell that to my minister friends, like, wait a minute now, Jesus didn't have Uber, he didn't have Lyft, he didn't have Uber Eats and all that. He had to walk everywhere.
Right.
So if we really go back to the old school way of taking care of yourself, I wrote a book called 5 Colors a Day to Better Health, when all my patients that were 100 years old were doing the same thing. I would see a patient, she's 90, very few pills, hair done, skin glowing, eyes bright. Then I saw a man who was 104 years old.
Wow.
Same thing, lean and mean and very few pills. I started asking them what they eat. They would eat, most of them had a little garden. I hope some of the people that are listening to this show, the man that was 104 years old, I said, how did you maintain your health for so long? He says, forget about reading the label. If it's got a label, I don't want it.
Wow.
Oh, wow.
So sometimes as younger people have to listen to those people who have proven themselves and have demonstrated that they know what they're doing with their health. So go back around to your question, how do you improve the circulation? But how do you improve the circulation across your entire body? That's what eating right and exercising and meditation and prayer are important to increasing the circulation in your body as well.
Man, he's speaking today. Preacher.
He's a foot doctor, but what I'm hearing is he works on the whole body, the mental and all.
You have to. And what we see in our community is that there's so much disinformation.
Come on.
It's the biggest disinformation campaign in the world. The last year, we experienced a disinformation campaign politically, but there's an ongoing disinformation campaign for Black people about our health, about cigarette smoking, diet and exercising, all those types of things. So what we need to do is make sure we're able to source good, viable, reliable information. And that's why I'm glad I'm on this show today to give you just a little bit of nugget here and there about some of the things I've experienced and seen in my journey.
Let's talk about how you screened over 30,000 men for diabetes and high blood pressure in barbershops. That's a great place because we go get our haircuts, and that's where we chill out and we're more apt to receive knowledge.
Well, as we know, Black-owned barbershops traditionally have been places where African-American men feel safe. We don't feel threatened. The outside world is riddled with so many different things, police brutality, drugs, and all types of things. But the barbershop of the black man has been kind of considered the black man's country club.
Yeah.
You get anything, that's our country club. You can get anything in a barbershop.
Fish dinner, everything.
You get everything. You can get you some new shoes. You can get you
insurance.
A wannabe Rolex watch. They don't do CDs anymore. You can get incense. You can even get socks.
A piece of pie too.
Yep.
So with that, I think spiritually, and I like to tell this story, that sometimes when God gives you an assignment, I don't even use the word purpose anymore. Purpose has too many loopholes.
Yeah.
Purpose sounds too cute.
Yeah.
But when you say that this is my assignment, that means you have some deliverables. You have something, some homework you got to turn in. So the Black Barbershop Health Outreach Program, that's my assignment to address the astronomical disparities in health in our community. In the main segment of our society that has the lowest amputation rate, the lowest life expectancy of black men. It seems that nobody cares. So I decided to take my practice outside the four walls of my building and take it into the streets. This is kind of like my ministry. When you have a ministry, you'll talk to one person or you'll talk to 1,000 people.
That's right.
It doesn't matter. And one of my old patients, and I love my practice, I have a lot of seniors, and one of my patients says, honey, men count numbers, but God can make numbers count.
Come on.
You don't have to have a whole lot of people. You just got to have the right people doing the right thing, and you get a lot of work done. So with that being said, we screen, my team of people, my small group of volunteers, we hit the streets. And we screen black men for diabetes and high blood pressure in black-owned barbershops across the country. There were times when we didn't know how we were going to get it done. And and the reason I'm telling this story from a spiritual perspective, the money wasn't flowing, the check is in the mail. We've all been there.
Yes.
We said the check is in the mail.
Yeah. Yeah.
And we have a big program that we're starting, and I was about to announce to the team that we're going to have to put the program on hold. I took a deep breath. I said, let me go get a cup of coffee across the street, and I'm just going to tell everybody we're going to have, and this is hundreds of people, that we're going to have to pause the program. On my way to get coffee, a brother says, are you Dr. Releford? I said, yes. Brother, I want to thank you. I went into a barbershop several months ago, and I've lost 50 pounds. My wife has lost 10 pounds. Man, you know what? I just want to hug you. And at that moment, I said, you know what? Let me keep going.
Yes.
And to get back to the office, there the check was in the mail. So sometimes you just got to keep moving, keep moving, and don't stop.
Faith.
So I love hearing you operate from a faith perspective. A lot of times when we talk to doctors, they have the science and they have the education, but they don't have the faith in the creator who has literally created this gift in them. And so from a very young age, you have that anointing on your life. So now I'm getting ready to pick on some folks, okay?
Pick on them.
Okay. Can you testify one way or another? Because I personally love to see my wife in high heels. It is nothing like seeing her walk across the room in some high heels and the cast are just like bam and everything like that. My question to you is, women who love to wear high heel shoes, how do they take care of their feet so that they won't damage their foot so well?
Well, wearing high heels is not normal from a evolution standpoint.
Correct.
We want to put on this earth to wear high heels. Sometimes we get focused on what we want to do.
Come on.
We want to make the body do some things it wasn't designed to do.
Yes. Yes, sir.
And so it depends. And don't get me wrong, there's nothing more fabulous to seeing a sister walk down the street.
Yes.
Not every woman knows how to walk in heels.
Yeah.
You've seen them, they walk like this.
Yeah.
But there's some women who really know how to walk. It's whenever I see Beyonce, I'm like, how does she dance and do all those moves
for hours
in high heels?
Yes.
However, there's a cost you have to pay for that, with bunions, all types of joint problems, hammer toes, metatarsalgia, heel pain, all types of things that you can pay the cost for. So that is not a normal thing. Remember, the foot was designed to walk on soft surfaces.
Flat.
Grass, gravel. You look at our brothers in Kenya, they run barefoot. You go to the South Pacific Islands, our brothers in Fiji are playing soccer barefoot. So the foot is very doable. Now, if we walk outside right now, our feet are so tender because we protected them so much, we'd be tiptoeing.
Yes, sir.
But the body, the good Lord created an incredible machine.
Yes.
It is very adaptable. So back to your question about high heels, wearing high heels has a cost. Yes, they are accentuate a woman's figure, her walk, the way she moves. However, there's a price you have to pay for that.
Okay, so for the women that say they can't let go of their high heels because the devil is a lie, can you give any recommendations of types of heels? You know, can you give them some hope, because they're kind of concerned now?
If you want to be able to wear high heels on an ongoing basis, don't wear them throughout the entire day.
Okay.
Carry your tennis shoes with you in your purse. Get to where you're going, to the club. If we're talking about this is a gospel show, I mean, I can't talk about going to the club, but that's where they make me want to go.
Right.
I have to tell this little quick story. We were in New York City, and the young lady who was driving us around, she had on tennis shoes, and she was moving around all fast. But by the time we got to the destination, the church that we were supposed to be ministering at, she walked out the car and she had her heels on. And we was like, when did you have a chance to flip into your heels? She said, this is New York City. We always got some heels around.
You New Yorkers, the women in New York, they all have tennis shoes and got their heels in their bags. So you may want to decrease the amount of trauma, micro trauma, walking on concrete and asphalt by only wearing the heels for the event or when you need to, but always have your safety shoes. There's nothing worse than when, in my practice, a lot of people are diabetic. They hate the diabetic shoes. One of my patients said, if you design some good-looking diabetic shoes, they don't make high-heel diabetic shoes.
Right.
And so the point I'm making is that when my patients travel across the country during the summertime, and they don't want anyone to know in Butterbean, Georgia, every state got a Butterbean, Alabama, Butterbean, Georgia, Butterbean, Texas. They're from California, so they want to look good.
Right.
So they don't wear the comfortable shoes, they wear the brand new shoes. But they get on that airplane, their feet and ankles swell up.
Yep.
And by the time they get off the plane, they walking all crippled. And they left their shoes, the handy shoes, the comfortable shoes, at home.
So someone had asked, our program director said, what about gels in your sole and memory foam?
All of those supplemental materials are very good. I happen to use the gel foam, sometimes my running shoes. You have different Spinkos, you have adhesive felts, you have all kind of different foams that are on the market. This is an individual thing. Sometimes I'll go through 4 or 5 different things until I find the one thing that works right for me and my activity. So that's an individual journey that everyone has to take. You know, Amazon has a lot of, and I'm trying to promote Amazon, they have a lot of good affordable orthotics that are online.
Yes, they do.
You can get for $20.
Yes, they do.
That's much better. And trust me, I wouldn't want to turn anyone away. But as a resource, you can go there with the direction of your physician. One of the strategies you may want to do is try some online. Tell your doctor these work for me, and then he can take those and customize them further, so you can save some money. There's nothing worse than spending $1,000 or $500 on something that doesn't work.
That's right. Now, I'm a head track and field coach. I've been coaching 33 years now. So we're going to get on the athletic side.
Perfect.
You look good. You look good for that long.
Yeah, I'm 52, but I still need to lose some weight.
Amen.
I went to get my feet looked at, because there's moving shoes, a place here that's very prominent, and they put you on the machine and they really walk you through everything. And I didn't know that if you're going to be a person who works out, you should get a shoe size one size larger, because your feet swells when you jog and stuff. Let's talk about that.
I mean, it can. Your feet can swell. Believe it or not, sodium intake can increase the swelling of your feet at the end of the day. Mm-hmm. So if you're eating potato chips, if you're eating, hot dogs, if you're eating sausage, bacon, cup of noodle soup, which is notorious for lots of sodium.
Sodium, yes.
If you're eating chicken noodle soup, that's even worse than that. Wow. That will make your feet swell. So you should actually shop for your shoes at the end of the day. So buy shoes not in the morning or the noon, buy them in the afternoon where your feet are larger. So you wouldn't want to necessarily buy a shoe that's an entire size larger. What you want to do is purchase your shoes near the end of the day.
And I did. It was a nighttime when I went. And for two, what really is athletics feet or athlete's feet?
Okay. That's a fungal infection of the skin and sometimes of the nail. These dermatophytes can get into your skin by being in moist surfaces for a long period of time, saunas, spas, jacuzzis, not drying in between your toes effectively. Bacteria and fungi love nice, dark, warm, moist places to do their little thing. Mm-hmm. So if you have the unfortunate condition of having a very sweaty feet, you will have a greater chance of having some type of fungal infection of your skin and nail. Usually it starts out by some itching. You may get some blisters. The fourth inner space is the most common route of infection into the foot, and it's the most common area for the beginning of a fungal infection because of the anatomy between the fourth and fifth toe. Lots of moisture there, nice, warm, cozy, dark environment, and the shoe or socks can initiate a fungal infection.
Okay, I have no arch. I'm flat-footed from running track and stuff, and so my shoes tend to go out. And when I run, it's painful. What is your suggestion for that?
So your feet are flat not because you ran track. Your feet are flat because that's how the good Lord made them.
Okay.
Running doesn't make your feet flat.
Okay.
That is, in some things, you have some very fast people with flat feet. So, however, you do want to have, if you do have flat feet, you may want to get an arch support, heel support, various different things you can put in your shoes to help support your feet. You may also want to be careful of not running on concrete and asphalt. That is what's going to do. That would do more damage than anything. Me being an avid runner, and even at my tender age, I still do all-comers track meets, 400 meters.
What? That's my favorite event, man.
Huh?
That's my favorite event to coach.
That's a man's race right there.
Yes, sir.
And that's a man's race, as a horse race, as they say. And at my tender age, I try to do at least one race a year under 60 seconds.
Oh, that's good.
I'm not trying to break any records or win the Mercedes-Benz, but I'm just trying to find a way to keep myself fit, to practice essentially what I preach all the time.
So let me ask you this question. This is going to be a three-part question. First of all, The ladies want to know, are there any cute orthotic heels?
He just said
cute orthotic heels.
Yeah.
They have some attempts to make orthotics that can fit in the heels, but they may not be that effective.
Okay.
Orthotics are designed to realign how the foot connects to the rest of the body. There's very little you can do with alignment in the heel. Remember, the body was not designed or engineered to wear high heels. Once again, we want to do it our way. We determined to do it our way at whatever cost.
Part 2. Our bishop here on the line says he struggled with plantar fasciitis. Any recommendations?
So if you would like to share, could you ask him how much does he weigh?
Say again?
How much does he weigh? Could he stand to lose a few pounds?
Okay.
I'm asking yes or no.
Yes, he could.
Okay, well, that's the first treatment there. So in medicine, I always tell people there's some things I'm going to do and some things you got to do too.
Right.
I don't want all that responsibility.
Right.
I know I feel good. I know what I'm doing. So I don't want to give recommendations that people go out there and they eat all the fried chicken sandwiches they can get their hands on. Then they come to the doctor and say, well, my feet hurt.
Bishop needs to lose weight. He's my cousin, and I know.
Next question.
Next question.
Next question. And this is one. It might sound funny, but I'm gonna ask the question and see if you can help. There are some folks that have stank attitudes, but there are other folks that got stanky feet.
And some got both.
So my question is, how do you deal with not the stank attitude, but the people that got these stanky feet? No matter what you do, their feet stink. What is that all about?
Usually, that type of foot odor is due to excessive moisture and sweating in the feet.
Yep.
So you may want to use a powder to absorb the moisture. You may use some types of solutions. Dumborough solution is a good solution. They help dry up the skin a little bit. Even, believe it or not, Botox injections in the feet can decrease the sweating in your feet and decrease the odor as well.
Say it again.
That is an option as well. Botox in the feet, yes.
Botox, the Botox?
The Botox, you can do that in your feet as well.
Well, okay, what about shin splints? Because, that's a big thing in track and field and sports. Hard surface, it could be that. It could be how your feet is planted in the ground. But let's talk about that because that hurts.
Well, shin splints, I treat that very regularly in my practice. I use a therapy called platelet-rich plasma, PRP. It's the same type of treatment that Tiger Woods and Kobe used when he was with us for their various injuries. You take a little bit of your own blood, extract the platelets, release the growth factors and the pain relievers, and you inject it up and down the tibia on the inside. And most of the athletes I treated, they swear by that. You got to keep stretching, and you have to make sure that you don't have a limb length discrepancy where one leg is longer than the other.
Mm-hmm.
When your body is just like a car. As long as you're walking, you don't really feel those imperfections. But when you're driving your car slow, it's fine. But you take it up to 45 miles an hour, and it starts going like this, rattling. Mm-hmm. Well, the body's the same way. When you're walking, it's fine. If you have a limited discrepancy, you start running, you start to feel those imperfections and those discrepancies in one leg being longer or shorter than the other.
So, doctor, what if you have a problem that you seem to always find yourself rolling your ankle and spraining your ankle because it seems like you're continuing to roll the ankle? How do you strengthen your ankle so that you won't roll them?
That has a lot to do with this patient that could have ligamentous laxity, where your ligaments are a little bit more flexible than they should be. If there's not any underlying conditions like that, orthotics would be a perfect solution for that. Ankle braces would be a perfect solution for that, and wearing the proper shoes. Wearing the deck shoes and flat shoes like that could really exacerbate that condition.
Yes, shoes is very important. As I tell my athletes, it's like your car needs to change your tire. Your shoes have to be changed every so often as well for the support and all the mileage that you put
Absolutely.
on that.
I mean, I recommend, depending on how many miles our runners are running per week, to run or change your shoes at least every 3 to 4 months minimum.
Wow.
Absolutely. If you put in, if you're running 5 miles every day, especially if they get wet, a little moist, or wet grass, it can do some damage to your feet. And also, too, they don't make shoes like they used to. Years ago, you buy a pair of Nike shoes, they last forever. Now, I think they're designed to tear apart so you can go back to the store.
Nike sucks. I don't push.
We don't push the brand.
That brand to my athletes because I've also coached at the collegiate level. Yeah. And a lot of schools are sponsored by these shoe companies and they have to wear them. But even talking to my Olympic coaches, they don't recommend that particular style because it's more fashion now. When it first started, it was more for the health and all that.
Well,
now it's
we're
fashion.
Talking about fashion versus function.
Yeah.
Come on.
Fashion versus function. In the old days, they functioned better.
Yeah.
Yes.
It wasn't a fashion issue. Now, tennis shoes are a part of, you go to the inauguration, you're going to wear the tennis shoes.
Yeah.
And we do want to let all the shoe and tennis shoe sponsors know that we appreciate your sponsorship, and we're going to look forward to you coming back with us.
By faith.
By faith.
Yes.
Now, I have someone who broke her toe, and she's wearing an orthotics now. Moving forward, should she wear a more sturdier shoe?
I mean, she may want to talk to her foot and ankle doctor about that. The body will let you know and speak to you the pain or discomfort. It depends on how she broke her toe. Did she kick the old man, or did she was just walking down the street and it just broke?
She broke it shouting, shouting for Jesus?
Or did she get the Holy Ghost and did a little too much?
Yeah.
So it really depends on how she broke her toe. If she broke her toe just walking, doing her normal daily activities, that would be something versus some form of trauma. So there's more to that than just making a determination like that.
Is there a certain brand that you would recommend? Because I tell my athletes to get more of the Sauconys, the Skechers, more that were made for distance running.
Everybody is different. I would recommend that you get your foot analyzed to make sure that you don't have a limb lift discrepancy. That's number one. Number two, I would recommend maybe trying a number of different brands. Even me as a foot surgeon, I've got to try 3 or 4 different ones. And you go online, they got a new one, and it's got good reviews. And so you just really now it's really difficult to determine which shoe is right for you. You got to shop around a little bit, and your body will let you know.
What do you wear?
I wear a New Balance.
That's one of the ones I was going to say.
And I got some new shoes that just came the other day. I think I got a pair of Saucony, and then I'm going to try this new shoe called Hoka's, Hoka.
Yep.
They have so I got those in the mail too. So I've been trying a number of things because I have a couple of, since things are going to be opening up a little bit, I may try to get into a race near the fall. You may see me on the track doing my thing down there. Where you all based at?
San Diego. This is the running. This is the running place. You know that.
I'm right up the road.
Right.
Yeah.
You still run?
No, I was going to start training to run U.S. Masters, but the music side is starting to really develop. This radio is doing well, and I'm going ready to do a TV show. So it doesn't afford me the time to put into running, because if I'm going to compete at my age, 52, I'm going to go to break every record there is, and I don't have the time.
Do that?
Oh, yeah, I don't play. Yes.
Yeah. So let me ask you this question, because, everybody's chiming in right now. So I'm going to ask these final questions and then ask you how people can get in contact with you. So one of the final questions is simply this. You talk about having your feet examined and analyzed. Do they do that at your local Kaiser? How do they go about having your foot analyzed? And do you recommend everybody do that?
It really depends on what your priorities are and what your goals are. Everybody has various goals and objectives. If you are a weekend warrior, you have your objectives. If you are a mail carrier, you have your objectives. If you are what's the word I want to use? A dancer, okay, you have your objectives for your feet. So everyone's feet has a role to play in their life. So it depends on what it is that you want to do. But I think that if you just want to have a general foot exam, I think you should go to your local foot and ankle surgeon. Kaiser may not be set up for that. They're not designed. They're more designed for a fracture, a wound, gunshot wound, trauma. They're not into preventive things like that. They're not into that.
Yes, and just for your information, the Olympic Training Center in Chula Vista, a part of San Diego, is having a series of track meets starting this Saturday. All comers meets, Olympians, just everybody, because this Olympic year and some of those athletes are trying to get their qualifying marks to even qualify for our Olympic trials in Oregon.
Right. Yeah. So let me ask you a question. You know, I don't want to go Kaiser. I don't want to go to Sharp. I want to come and see you. How do I get in contact with you and get my appointment with you? And do I have to sell my firstborn to get to see you?
No, I wouldn't do that. And no, one of the things that we're very proud of is the development of our app called Black Doctor 24/7. And Black Doctor 24/7 is an app where a Black patient can see a Black physician online through telemedicine. So you can contact me by downloading the app called Black Doctor 247, either on the Apple Store or the Android store, blackdoctor247.com, or you can learn about it. So you can download it by going to the Apple Store or the Google Play Store, or going to blackdoctor247.com.
Yes.
Okay, so hold on.
Thing was that
Black
that
Doctors 247?
Black Doctor. BlackDoctor247.com. Go there.
Okay. Adele or Michelle, if you can put that. Okay. Put that up. BlackDoctor247.com.
You can also contact me by going to RelefordInstitute.com. That's RELEFORD Institute, INSTITUTE.com. RelefordInstitute.com. You can make an appointment to see me there as well in my office.
Right. It's that app that I heard about that brought me to your attention, to me, that app. Let's talk a little bit about that a little bit.
As you know, COVID-19 has been bittersweet. We know the bitter part very well, but the sweet part is that it has facilitated innovation and creativity. One of the things that I was able to create was an application because our Black community has been affected disproportionately by the pandemic. People are not going to see the doctor, so we developed an app so people around the country who want to talk to a Black doctor about, is it safe to take the vaccine? Who want to talk to a Black doctor to know about the signs and symptoms of COVID-19. So I developed an app that has actually some very interesting technology in it where you can check your own vitals. I can look at your heart rate. I can check the respiration rate with the app. We have a bot inside called Amina. Apple has Siri. IBM has Watson, but we have Amina. So we say, ask Amina.
All right.
Amina.
Ask Amina, download the app, and then ask Amina any question that you may have, and Amina will give you a pre-diagnosis of what's going on.
Go, Amina.
So
don't ask Siri, ask Amina.
Ask Amina.
Okay, so let me ask them. Does Amina got a little street in her when she responds? Look, I told you to eat right.
You know what? I may have to, for some of my patients, I may have to do some Ebonic version.
Right.
Yeah. So check this out. We are now getting it all into place. You were brought to us by none other than Regina Wilson.
Of course.
Yeah. Regina Wilson said, you got to interview this doctor because he's dope. And so now that we've established, the connection and how we got together. You need to come to San Diego. I'm going to get a barbershop ready for you. You need to come on to San Diego.
We've been to San Diego a number of times doing the California initiative, and maybe you all can help us to, when we do our next road show in the next month or two, still design our next Black Barbershop program. We do want to incorporate some of the barbershops down in San Diego, so maybe we want to give you a call.
Of course.
Help us organize that.
Man, I got you.
Whatever
I know
you
some
need.
of the best barbershops in the city. As you can see, that cut is fresh, so you got to go over to my barbershop. But definitely one of the things that we definitely want to do is to support you. This Black Doctors 247.com is amazing. We want to make sure that we continue to push it out there. Hit us up because I believe our advertisement rates will fit right where you want to be, but we want to push this app all the way through because it's impressive and it literally will help people that are afraid to even have the conversation begin to have the conversation. And as you can see, Robert Earl Dean's haircut. Who do you get your haircut by?
From Joe. I'm going this week. I can't remember the name.
Okay.
Put me on the spot. Praise God.
Yeah.
But yeah. But I'm gonna connect with you on behalf of the station.
Good. Please do. And we are willing to help to sponsor, to support your station, and with advertising, just let us know.
Yeah, and Amina, for the women, Amina may tell you to lose weight and to put them heels off. So be ready to receive whatever Amina says. Amen.
Yeah, and the one thing that when we do get here, the one thing that we can do with the barbershop series is we literally can go live with a 3 to 4
Live
camera
remote.
shoot,
Yes.
live remote, onto social media sites everywhere. This is amazing, everybody. This doctor right here is on the cutting edge.
Dope.
He talked about feet, but then he dropped the bomb about the app. And so, sir, we salute you, doctor. We salute you. And any final words before we gonna get back to John P. Key saying I made it.
Thank you.
Thank you so much. We appreciate you.
Thank you so much.
Trust me, we're gonna hit you up right after we get off the air today. All right.
I got you. Thank you so much. I appreciate that.
All right. This is GOD Radio 1. This is none other than Dr.
Bill Releford.
Right here on GOD Radio 1. Come on, John. Bring us home.